So now we're going into the post assessment, and the main thing that we're looking at is to see if her left knee continues to make that valgus tracking while she goes into dorsiflexion, but we'll also check in on her pronation of her left foot, which is that one. So we'll go through the video and we'll see some views to see if there's any difference. Looking pretty similar from the lateral view. I'd say we're looking pretty similar right now, if not maybe slightly more pronation. And from the medial view, we can see that her medial longitudinal arch is still pretty flat. And then we're going to go into her single leg stance. Still see that pronation. Not seeing any changes. Pretty pronated there. A little more of an arch, but that is mostly the same as her pre-assessment. And now we go into her single leg squat. So this is where we're going to see if there's any measurable changes here. So we're looking at her knee, and we're going to see if it still dives inwards. So let's play the video. And we can see it does still go inwards. So let's rewind it and play it in slow motion. And we're going to watch how the knee tracks. So it does seem to have a little more of a varus pull as she goes down, because her knee does seem to wobble a bit more than it did in the first video. So we start to see the knee when it goes down. Following it, it kind of wobbles. Oop, let's rewind the video. I'll use it without the cursor tool so you can see it. So we'll highlight it. We see it comes outwards a little bit, and then it starts to dive inwards, where it's almost touching the other knee. But we can see it wobble back and forth, which means that Elizabeth still might be trying to self-correct. Let's watch the rest of it just to see if there's anything else. The depth of the dorsiflexion and the knee bending, knee flexion looks about the same. Looking at it posteriorly, we see that pronation at the end range of dorsiflexion still. And one more time. And we see that pronation, slight pronation at the end range of dorsiflexion still. But overall, we don't see any visible changes shown in pronation, dorsiflexion, or knee valgus during weight-bearing single leg stance and single leg squat. This is indicative that our treatment method did not work. However, this is the result that we were expecting due to the least amount of treatment for one session. Elizabeth's pronation has been with her for her whole life as well, so one session probably would not make a difference. It would take multiple sessions to see measurable changes. This treatment could still be a viable option with more sets and continued treatment sessions. Elizabeth would be here to say this herself, but she's in quarantine right now, so this is her reflection upon the exercises as according to the rubric. She says, due to past injuries, I am very in tune with my body. I can cue myself on changes that need to be made in order to achieve a tripod stance. In this lab, I found it neither difficult nor easy to perform each task within the tripod stance. However, post-treatment, my ability to perform ankle dorsiflexion felt more attainable, and my motion felt greater. I felt as if my pronation was greatly affecting my ability to perform the single leg squat. Therefore, I had to correct the valgus force shown during knee flexion. Post-treatment, when not performing any task, there was no difference, only when performing single leg squat. And thank you for listening.